Good morning, everyone, and welcome to the Cradle&Mum newborn series. It's been an amazing time, and today we're going to talk about the challenges of the preterm baby, especially with regards to how concerned the mothers are, as in what is happening to my baby. Why does my baby have to be in the neonatal intensive care unit for a long time? Some of the children stay there for 1 month, some stay for 2 months. So here's the problem. These babies have come out very early. Remember, they were supposed to be in the mother's womb. They were not meant to be breathing. They were not meant to be digesting food. They were not meant to be making blood. So when they come out that early, the lungs are not mature. So they usually require some form of respiratory support, oxygen, sometimes ventilators, and so on and so forth. Remember that their intestine is not ready to digest food. The mother was supposed to be providing nutrient through the blood. So usually the doctors have to struggle to give IV fluid so they can get their nutrients, which is not adequate, and then gradually introduce feed. So the introduction of the feeds usually takes time, and breast milk is usually the best. So the mothers may have to come in to give breast milk, for the baby, and then sometimes the baby doesn't tolerate, we stop and we continue. So it can be quite challenging for the mother and for the family. Then also the baby is not ready to produce blood. The blood was from the mother's body and it was okay with that, but here now it's required to make blood. So baby may require a couple of blood transfusions, and the doctor would also tell you why it's important. Another challenge they have, like we said, is the temperature regulation. So the incubator is not a treatment for the preterm baby. The incubator just provides warmth for the baby, because sometimes parents are like, oh, my child is in an incubator and all that. Yes, the incubator is something the baby needs, but that's not the treatment. It's just part of the treatment to ensure that there is warmth for the baby. And in some areas, they actually use something called a kangaroo care system, where the mother puts the baby to her body and there's a contact and the baby is kept warm. So because the baby is also prone to infection, the neonatal intensive care unit is a place where mothers, or not mothers really, where people are kept out of. The mother has a chance to come in and bond with the baby, but generally it's been encouraged that we increase parents' participation in the care of the newborn. So that's basically what happens with the newborn, and it takes time for these preterms to gain sufficient weight to now leave home. So it can really be a trying time, but with the right encouragement, the babies actually do well and they go home.